Hey warriors, welcome to another video. For those of you new here, I'm Rachel Marie of Sleepy Santosha. I am a yoga instructor and chronic illness warrior living with Addison's disease and hypothyroidism. And today I just wanted to share a little bit of my journey with you. I wanted to talk about the treatment path I am taking with these illnesses and whether naturopathic or allopathic medicine is better for chronic illness. So naturopathic medicine, meaning natural therapies like using herbs, vitamins, dietary and lifestyle changes. And then allopathic medicine, meaning contemporary medicine, treatments such as pharmaceutical drugs and things like that. For those of you following me on my Instagram page, you've probably noticed that I have been in a bit of a flare-up for the past month or so. I was diagnosed with hypothyroidism at the beginning of February and was started on a natural desiccated thyroid medication, which is derived from pig thyroid, so it contains both T3 and T4 thyroid hormones. A lot of people do really well on this medication. However, my body did not respond well to it at all. I actually saw a drastic worsening of my symptoms on this medication. And having Addison's disease does kind of complicate things a little bit, so my doctor instructed me to stop taking the medication. And we are actually going to explore some natural options, some herbal remedies for hypothyroidism. So I'm pretty excited about that. I'm excited to kind of experiment and see what works for me. And in a couple months we will retest my thyroid levels and see how these therapies are working for me. Along my journey with chronic illness, I have tried so many different treatments in the hopes of improving my condition. And these treatments have been both naturopathic and allopathic in nature. So it's been kind of an experiment finding what works best for my body and what doesn't. And it can be frustrating at times trying all these different things and spending all this money and, finding that most of the stuff doesn't even work. But I like to look at it as a learning experience. This is a chance for me to get to know myself better, a chance for me to get to know my body better. And that's kind of been the cool thing about having chronic illness, is that I've gotten to learn and research so many things that I never would have known about had I not gotten sick. So it really is a whole new world, and I'm actually kind of grateful for that in a way. But what I have found works best for me and my body is using a balanced approach to medicine, so finding the best of both worlds. I have a really great integrative medicine physician who knows both naturopathic and allopathic medicine, so she gives me the best of both worlds. She helps me to use herbs and vitamins to supplement the prescription medications I take. So when I say medications, I'm talking about the medications I take for Addison's disease. And these medications are considered bioidentical hormone replacement. So these medicines mimic the hormones that my body would have produced naturally on its own if it were healthy. So these medicines fortunately don't contain the harmful ingredients that you might see in, say, narcotic medications or beta blockers, things like that. However, if you're someone who does need those medications to treat your illness and to allow you to be functional, I want you to know that that is perfectly okay. The choices you make to treat your body, however you choose to treat it, are your choice, and no one should be able to shame you for the choices you make for your health. Your journey is completely unique to you. Every illness has its own idiosyncrasies, and everyone's body has its own unique constitution. So comparing your journey to someone else's is not fair. It's not fair to you. The way illness manifests in your body is going to be different than the way it manifests in another person's body, even if you have the same diagnosis. So be patient with yourself, have compassion for yourself, listen to and honor your body. The best treatment options for you are going to be the ones that you feel the most comfortable with, the ones that give you the results you desire and come with the least amount of side effects. Following a holistic treatment protocol just for the sake of saying that you're 100% natural is not going to be worth it if it compromises your quality of life. The same holds true for 100% allopathic treatment options. Don't limit yourself to one school of thought just because it is the standard. So I would encourage you to open up your options and consider exploring both naturopathic and allopathic medicine. Find yourself an integrative physician who understands both, or maybe find a team of physicians who are willing to work together to give you the best treatment options for you. And always know that whatever you decide, you are always supported and always loved. Thank you so much for being here and watching this video. If it has helped you in some way, I hope that you'll give it a thumbs up, and don't forget to subscribe to my channel. I post videos every week, and these include videos like this talking about chronic illness and also full-length yoga practices for chronic illness warriors like you and me. If you have any questions or would like to share your story with me, please leave me a comment below. I would absolutely love to hear from you. Have a beautiful day. Namaste.